What's up, poopers? Do you have knee pain when squatting or going down the stairs or sitting for a long period of time? You might be dealing with patellofemoral pain syndrome. We're going to go over some early rehab exercises in this video. My name is Dr. Marco Lopez, co-founder of the Basketball Doctors, and our goal for the Basketball Doctors is to improve your basketball performance and help you play basketball pain-free. Our information is just for informational purposes only, not medical advice. If you need medical advice, seek out a local healthcare professional or send us an email, see how we can help you. But let's just jump into the topic of patellofemoral pain syndrome, early rehab. So patellofemoral pain syndrome, what is it? Click the link above. This is a video where we go all things patellofemoral pain, but I'm gonna quickly summarize it. So here's your knee, here's the outside, here's the inside. Here's your patellofemoral joint. So it's the kneecap with that femur bone here. It goes into that little groove. What happens is you'll have pain due to increased pressure and a lot of things, but increased stress in this joint. So when you have increased stress in this joint, it's very irritable. So what we see with basketball players is they can't really squat, they can't go down the stairs. They're like, oh man, it hurts right in the knee. And it's kind of hard to explain. It's like, oh, just across the knee. Sometimes it goes out to the side, even behind or even below the knee. So early on, we have to strengthen the muscles that we need to strengthen to be able to elicit a response where these quads become strong enough to help decrease the stress of that knee joint here. However, when you're trying to strengthen the quads, it's gonna hurt because the patellofemoral joint might take too much of the stress. So what do? So we could start strengthening, however, we gotta understand the biomechanics of the patellofemoral joint and strengthen around those parameters. So when we talk about the patellofemoral joint, the most stresses in this joint come in two different ranges depending on what exercise you're gonna be doing. So let's say we're doing an extension-based exercise, and we're gonna give examples after this, but we'll kind of break down the biomechanics of it. So let's say your leg's floating here, and you're sitting down and you're kicking out your leg this way. When I'm lifting my leg this way, I have the least stress in the patellofemoral joint here at around 90 degrees. Then it starts getting more stress the further I go up. However, from 90 to about 30 degrees, I'm in the safe zone where we like to load our patients between 90 to 30 degrees early on. Then we work our way. It doesn't mean you can't do a full knee extension. When you have patellofemoral joint pain, it might be contraindicative because of the pain. However, like I mentioned, guys, we're going up to 30 degrees because from 30 degrees all the way to 0, that might have more patellofemoral joint stress. And if your knee joint is not ready for it, it might piss off that patellofemoral joint pain. So that's why early on, we're gonna avoid those deep or those full extension from that 30 degrees to 0. However, when we're squatting, it's a little different. It's the opposite. So that's called closed kinetic. So this is open kinetic where we're moving our leg. Closed kinetic is when our leg is stationary and our femur is moving. So when my femur is moving, the first, I'd say 45 degrees, you're the safe zone. After 45, 50, 60, 70, there's more stress in that patellofemoral joint. That's why it hurts when you're going down the stairs, you're really bending that knee, or when you're going to that deep squat. The deeper the squat, the more stress in the patellofemoral joint. So early on in the rehab, ideally we do want you to do a full squat. However, it's not going to be very friendly for your patellofemoral joint when you're in pain early on or when you flared it up. So early on, we'll stick to more of a wall sit or an exercise where we're only going down to around 30, maybe 45, maybe even 50, 60, less than 90, and then slowly progress it lower and lower. So if we start at 30, let's go to 60, then let's go to 90. But you don't want to start at a 90-degree squat or something because that's going to put more stress in that patellofemoral joint. And we talked about it. The reason you're having pain is because you already have too much stress here. So those are some of the do's and don'ts in the early rehab, and we're going to go over some videos right now on how to implement that for you. Alright guys, for the first exercise, we're going to go open kinetic chain. So as we mentioned, the difference between open and closed is open, your legs going to be freely able to move. Closed, your legs fixed down. So as we mentioned, when we're doing early rehab, patellofemoral pain, we don't want to go in the last 30 degrees. We want to stay more in that 90 to 60 to maybe even 30. But slowly progress it up. So I'm going to show you a way to progress it early on in your rehab to target the quads without putting pain in the patellofemoral joint. Grab a band. You can use any kind of band. We're using a crossover symmetry band here. So you're gonna place this band, you're gonna use it here, so that way I'm gonna provide resistance with my back leg. So early on, you wanna just make sure you put this back leg here. You wanna just kick out to around here. We're not going all the way up, and I wanna go here, hold it for a couple seconds, then come back down. Then kick it out, feel that quad muscle working, then come back. So there's two options. We could do a little isometric in this position where you're just gonna hold it, feel that quad muscle working, or you could go for reps. Early on, I would say start with a little isometric, then work your way with some reps, even higher reps, so maybe go 15 reps. As your knee joint feels good, then go higher and higher. Then eventually, once you get to 30 degrees, hold it there. Then eventually, once you feel strong enough, you go full range if it's pain-free and come back down. But as I mentioned, early on when your knee joints flared up, you don't want to go all the way. Just stop right at 30 degrees. Alright guys, so now we're going to go over the close kinetic chain. So as we mentioned in the previous exercise, that was more open chain where your legs move around. Close kinetic chain is when your foot's stationary. So when we talked about like the biomechanics, when we're doing close kinetic chain, we don't want to go past 45 degrees, because the more you go past 45 degrees early on, it's going to be more stress in the patellofemoral joint. That's only going to irritate the joint. We don't want to irritate it, we want to strengthen it early on. So when we're looking at a squat, I'm going to do a squat early on when I have patellofemoral joint pain up to around here. Then slowly hold this position. Then from there I could do reps, maybe go up to 15, maybe even add a weight. And then slowly, as you feel stronger, you work your way lower and lower, eventually to around that 90 degrees. But 90 degrees, that's going to start putting more stress on that patellofemoral joint, because as you notice, as I'm going further in 90 degrees, my knees are bending further past my toes, getting towards my toes, and that's going to put more pressure on that patellofemoral joint. So early on in rehab, as we mentioned, stick to those open kinetic chain ranges, or when you want to do a single leg squat or a lunge or any movement, just go up to like 45 degrees and then come back up, and then slowly work your way down. Hopefully you guys learned a lot in this video regarding patellofemoral pain and what to do in the early rehab. So a quick summary: avoid 30 to 0 when you have an open kinetic chain, meaning you're extending out or you're using that leg machine, or when you're squatting, avoid that deep squat early on. But that doesn't mean you're gonna avoid it completely. You just avoid it early on so you won't irritate the joint, and then slowly progress it. So if you guys liked the video, hit the like button, subscribe button, share it with friends and family. But we are the basketball doctors, let's ball for life.